admirable, attractive, and acceptable Montessori schools in Ibadan City with global standard of teaching, unique learning aids, and world-class academic facilities in a serene environment. Wow! Few students in a class with all conveniences, parent and guidance. Dynamic Pillars is the best place where your dearest child can have the best educational legacy. The school has the best set of professional teachers with brilliant and effective educational activities such as Montessori skills, math helping game clinic for vocabulary development, arts, crafts and design, diction and communication, French, music and game language mechanics, indoor and outdoor games, and lots more. Available classes are crèche, daycare, preschool, after school, primary and secondary school classes from JSS1. Entrance examination on request. Enroll your child now at Dynamic Pillars Montessori International Schools, New Garage Bus Stop, Akpata, or First Gate, Owode Estate, Akpata, Ibadan. Telephone 080-2342-1126. Dynamic Pillars Schools. Your child deserves the best.
Junior, get inside. You don't want to let mosquitoes bite you, do you? Me, I cannot treat malaria again, no.
Mama Junior, children will play. It is you that should keep your environment clean in order not to breed mosquitoes.
Even after netting the whole house and sleeping inside the insecticide-treated net?
Of course. Don't you know the state of your environment is as important as inside your house? Yes. When you get rid of stagnant water at every space mosquitoes can breed, be rest assured, Junior can play all he wants.
My friend, the honorary doctor, I will do just that so that my family can say bye-bye to mosquitoes.
Not just mosquitoes, but malaria.
Together, we can achieve a zero malaria society.
This message is from Solutions Nature 3.9 FM.
Well, it's a beautiful Monday morning right here on Remedy Dial Solutions 93.9. 23 minutes gone past the hour of 9, and I welcome you to another edition of Solutions Clinic, where we get to talk about everything and anything health. My name is Victor Richard. Hope you had a great weekend, and I hope that you've continually made your health a priority. Like I would always say, a healthy life is your ticket to a wealthy life. I did mention earlier that this morning we're going to be talking about fibroids. Remember that we're streaming live on Facebook as well as YouTube at Solutions 939 FM, so do well to jump in on the platform and, of course, lend in your thoughts. If you have questions regarding the subject of interest this morning, do well to send it, on Facebook, or you could use our WhatsApp number. You could do WhatsApp or regular text to 0904 422 2939. All right, by way of introduction this morning, fibroid is a health topic that affects many women worldwide. Fibroid is a non-cancerous growth that can develop in the uterus, often during a woman's childbearing years. These growths can vary in size and may lead to various symptoms. Sadly, fibroids over the years have been characterized by a lot of myth. So today, we'll explore what fibroids are, their common symptoms, risk factors.
Carry something, so to speak. So you either give it a baby or it carries a fibroid. So every uterus has a tendency to carry something. So just the way prostate issues are common to men. I mean, for men it's about 50% of men. For women it's even more. We have more women coming down with fibroids. Almost every woman I've come across. Probably now I would say we have more women with fibroids than those without.
That's quite sad as it is, but I mean it's something that is inevitable.
Yes.
But then again, I think my next question will be, it's been also said that most fibroids do not show symptoms. They don't show symptoms, so you don't even know that you're carrying these fibroids.
Yes.
So in cases like that, what can women do?
Thank you. The commonest, let's now move to the symptoms, because women will not know, and I will not ask every woman to go and be doing scan now because they want to know if they have. But then it comes with either the period is overflowing or not flowing at all. Okay, yes, that's menstrual irregularities. common symptoms aside from pain during this menstrual period. Some people might just have this extra pain, and one thing will lead to the other. You now be like, okay, let's check what's causing this pain, and you realize that there is a fibroid coexisting in the womb. And at that point, you'll be able to say, okay, this is the reason why the pain is in excess. Some, the bleeding will be in excess, either in the number of days or in the flow, in the quantity of flow. Some will tell you they use probably 4 days, 1 pad per day, 4 days, they're done. They now have to change pad 5 or 6 times in 1 day. So you see the flow has increased. Or the period goes from 4 days to 1 week, 2 weeks, 3 weeks in some cases. So these are things that when people start having these complaints, you need to ask them to do a scan to check what could be causing this. And of course, fibroid is just a next door neighbor to such symptoms.
Wow. And I also read, at the course of my research, that it's very common with black people as opposed to the whites.
Yes, it is.
Is there a reason why that is prevalent with blacks?
Well, not giving us reasons, aside from the fact that just like hypertension is more in the blacks, you know,
Or
the
mosquitoes.
preponderance is with the race. Mosquitoes. And the preponderance is with the race. That's it.
We're dealing with a lot as black people.
The weather is another one. I've been looking at myself
Yeah.
like I'm becoming darker every
Yeah.
day. Despite that I bathe very well. And I'm like,
The sun is doing numbers on us. Oh well. And you mentioned that if you starve the womb, is it that you give the womb, the uterus something, or it
Yes.
gives you something?
yes.
So it makes me wonder, for women who are getting to menopause,
Yes.
does that mean that they would have to deal with fibroid? Because at that point you're not carrying anything.
Many of them do. Yes, many of them do. The lock is that the moment menopause sets in, the reproductive system winds down. So fibroid and other things shrink. So that's a lot. So many of them, they just tell you, they had, but never got to remove it because it never disturbed them. But there are also a number of people who had to go through surgeries to either remove the fibroid or the whole womb because it was disturbing. So for those it disturbs, they have to do something about it. As a matter of fact, it puts their life at risk. You can see somebody who bleeds 2 weeks in a month. Such a person would always be at the borderline of blood level.
Absolutely.
Exactly. So you have to take a decision. And so many people, it's also responsible for lots of infertilities we're having. For each time I have to deliver a woman with a baby and she had a fibroid, I'm extra thankful to God. Yes. There's a picture. Let me see if I can show you. It was, we didn't even know this woman had fibroid. It was right in the theater we realized she had fibroid. And the fibroids were big. And I was super grateful to God that she was able to carry such a fibroid together with a live baby. And she delivered the baby. And
Oh my God. This is the fibroid.
yes, it is.
Oh my God.
Let me just speak. I have a lot of them on my phone. There was one we met. The fibroid was bigger than the baby.
Oh my God.
And we had to transfuse her with blood. We had to take documentation of the surgery so well because the relative available could not account. So we needed to give vivid detail to the family members as to what we found bigger than a bull. A bull, yes, bigger than a baby.
And it brings me to abdominal distension.
Yes.
Because more often than not, I've seen cases, even though more often you see these things in movies or in deliverance sections in churches,
Okay.
where you hear women saying they thought they were pregnant for
Yes.
a period of years.
Yes.
And they
They
didn't
didn't know
know
it
that
was
it was
fibroid.
fibroid.
Yes, and just because they failed to do scan. That's simple. We're in Africa, a very religious continent, where we believe our religious leaders over what is obvious. I'm not saying you shouldn't believe your religious leader, yes, but then even the pastor will tell you if you go to him one-on-one, he'll tell you go and see the doctor.
Absolutely, yes.
So why take all he says hook, line, and sinker when he says Every fibroid, get out in Jesus' name. Amen. Please go and do scan. So when you do the scan now, and you realize the fibroid is off, then you can now go thank God that you've been healed. But to say you will not do scan and then your tummy is protruding, hey, and then you say you are pregnant, you will deliver after 2 years. You know, when I see people like that,
You know,
I feel
you just
bad
said
for
that
them.
I was pregnant for 2 years.
Yeah,
So
well-
it's not pregnancy at the end of.
I used to feel bad for them when I see people like that. And then I'm asked to do a scan. Dr. Ejo, I want to loan you. Oyunye is about 1.5 years now. Ejo, I've had one condition no more. And then you put your probe on the uterus, and then you're like, oh my God. You know, you can't even speak up. Oh my God, there's nothing here. Madam, how long have you been pregnant? This is about 1.5 years now, going to 2 years. I'm when them, I move. And I'm like, hey, my God, dude.
Does it move?
Fibroid, of course, moves. It's heavy now. You're a moving being. Your eyes have the roll. So to move and give them all those, fake feeling. Only to realize that there was no baby anywhere. It was fibroid all along.
Can you, judging from what you've said about your patients, it
Yes.
means there can be a growing baby in the stomach
Yes.
and, fibroid. I mean, that's what I'm saying from what you said. And
Yes.
they would survive.
That's why I
The
said
chances are.
yes, and I've seen a couple of these, and I'm always super grateful to God. I eulogize God so much when I see them. I'm like, God, you're so awesome. And the fact that some of them don't even know they had the fibroid is what is absolutely amazing for me.
Women like that, do they deliver naturally?
Many of them don't. Many of them don't. And in fairness to this particular one I showed you now, she's had a couple of deliveries, though they were all surgical for some reasons. And I understand from the history that there was no fibroid as at the second surgery or thereabout, or the third. But this particular one, they found a huge one. So it simply means that the thing grew so fast, just within maybe a year and a half to 2 years. And I'm just super grateful to God for them.
Well, you're listening to Solutions Clinic this morning on the Remedy Dial Solutions 93.9 FM, and we're talking about fibroids. Shortly, I'll be taking your reaction, so you can do that via our WhatsApp line. You can send messages on WhatsApp or regular SMS to 0904 422 2939. 0904 422 2939. If you've had experiences, with fibroids, or someone who has, this is the best time to reach out to them so they can gain valuable insight, with the conversation we're having right here in the studio. So shortly, I'll be taking, the messages you are sending to me. All right, let's also talk about the treatment option for this, because I've heard that not all fibroids are harmful.
Yes.
I mean, even for my introduction. So
Right.
it's quite contradicting for me. They're not harmful and they're harmful at the same time. So are they characterized into different types?
Thank you. Basically, fibroid is fibroid. They are smooth muscle tumors. What differentiates them is the size. We've seen women with tiny fibroids, and all they lived with was just those tiny stuffs, and they never were operated, and they had all their children themselves, and they went into menopause, and they're quite aged now, and they are living so good and happy, and nothing happened, and the thing has shrunken with the uterus. While we've seen a 20-year-old young girl or young woman whose fibroid is as big as a head of a newborn baby, and you wonder how come at 20 you have so much big fibroid like this, and you see somebody who is 68, 70, 75, and then all she had was tiny ones that never really disturbed, and she's menopausal now, and she's living fine. Well, we can't question God, but all we know is that the bigger the fibroid, the more the symptoms, the more the problem. Then they are the ones that usually present with pain and feeling of movement in the tummy, big tummy protruding and all that. And they're the ones that also have this issue of losing babies because of the fact that the fibroid is probably exerting pressure, causing the mouth of the womb to open and the baby drops. These are symptoms. These are things that comes with the
that
size.
makes sense
Yes.
now.
Some people now, the position of the womb, imagine a womb like this and the fibroid is on top. and then the baby finds its way in. So over time with pressure, it will force.
Is that the cause of miscarriage?
Yes, it's also a cause of it. Yes, it's a cause of it.
Wow.
So, that's
I mean, speaking of, I know that there are no causes identified.
yes, you
cause
can,
of it.
yeah, exactly.
So, is it safe to say is hereditary?
Now, the truth is, yes, some of these things, there are positive family histories, part of things you should take note. So if you, just like the breast lumps and breast cancer, just like prostate and co, just like some ailments like diabetes and hypertension, once there's a positive family history, that is a sibling or a parent is involved, we have to keep in mind that such a person is at risk of developing it. So we just to say, take note of these and work towards it.
All right, we're now getting some questions that I'll be taking right now. Make sure to send yours to 0904 422 2939. Here is a message from Mrs. KG, and she says, should submucous fibroid, especially if it happens during bleeding, I'm sure, especially if it happens during your period, sorry,
Okay.
should it be mistaken for fibroid? See,
Okay.
I don't know what
Submucous, I understand.
That's okay.
Yes, submucous fibroid is let's just call it fibroid in the wall of the womb, okay? Not disturbing where the baby should ordinarily stay. Yeah, the womb has various parts. We have the muzzle part, we have the endometrium, we have the myometrium. The endometrium is the inner part where the period comes from, where the baby eventually stays. It's like so quote and unquote where the grasses are there. That's the place where the baby will implant and then keeps the baby, and baby grows. And even during delivery, even during the cesarean section, you make sure that after you've removed the placenta, you look for the tiny particles of the placenta removed from the endometrium because of persistent bleeding afterwards. Okay, that's the endometrium. Now we have the myometrium, the muzzle part. Now the fibroid that does not impinge into the endometrium stays in the muzzle part. That's what they call the submucous fibroids. Now, submucous fibroids, depending on the size, if it is not big, there's no issue. But the bigger the size, the more it can encroach either outward or inward, that is to the outermost part of the womb. Okay, that's how you see the ones that are pendulous, like this one I showed you, was not in where the baby was, it was outside. So all we needed to do was to slice and then move it like a ball and then trim the edges and then close neatly. It didn't get into. There was a patient like that we operated March last year, and under some miraculous circumstances, July, she turned up. I can't sleep. I'm feeling somehow. And she was talking about pregnancy symptoms. And we did pregnancy test. Boom. She was pregnant. That day, we felt like opening the window and jumping out. Three months after fibroid surgery. And I tried quickly, casting my mind back and realized we didn't actually encroach into the endometrium. That's where the baby should stay. So there was no scarring. The endometrium was intact. And possibly after removing all the weight that did not maybe allow the uterus to position itself properly, it was now positioned. And then, God, I thought how to just let me just try. And then,
entered immediately.
No. And today they have their baby and they're so happy. Yeah. So submucous fibroid should not disturb if it doesn't encroach to the endometrium where the blood should come from during menstrual period, or where the baby should sit during fertilization and implantation. So if it is big enough, it may disturb any of those two. Ordinarily it shouldn't, which is why if you are diagnosed with a submucous fibroid, then you need checks every 3 months to know the size and the eventual location. If it's expanding, how is it expanding? We need to know that.
But that is not harmful, is it?
Well, if it's not big, it's not harmful.
It's not harmful.
The moment it starts growing big, then you need to do something. It can cause issues.
Okay. What are the treatment options available for, fibroid as it is?
Thank you. It starts from doing nothing to removal. Doing nothing in that fibroid about the size of this thumb, leave it alone. Size of a thumb. And then you are 45, you're done with all your kids, and you just noticed when you did a scan that there is fibroid, your period is regular, everything is normal. Leave the fibroid alone. Must you go remove it? No. But once it's giving you symptoms, heavy bleeding, pain, no matter the age, get it out. A lot of people will tell you they will take some drugs, buy this, buy that. They are all trial and error medications. Treatment is by surgical removal. Some people can do a lot of other procedures, thermal ablation. You want to do this, do that, but that's just purely medical jargon that we may not really understand. But to the common man out there, get it out. If it's symptomatic, remove it. But if it's not symptomatic, then go your way.
You know, you just mentioned something, and there's a question in that, and this is from Lele. She says, I hear taking drugs for fibroid treatment can reduce one's chances of fertility. How true is this, doc?
Now, you see, most times, the drugs you might be taking, I hope they're not hormonal, because if they're hormonal, they'll mess with your menstrual cycle, also mess with your chances of conception. If the fibroid is huge, then get it out. See your physician and let him give you the best of idea. But really, I don't want to scare people here, because I have seen fibroids become cancerous. Yes, and like I said, I don't want to talk more about that. So if you know you are harboring a fibroid that is big, please remove it. If it's disturbing, remove it. The bigger, the more reason for its removal. Because if it continues growing, it can become cancerous and it kills. Absolutely.
All right. Yusuf is asking this morning, is it safe to remove fibroid during pregnancy?
During? Or you mean during delivery?
Yeah,
No, nobody will go removing any fibroid during pregnancy. It's not safe. You can only try a removal like what we call CS myomectomy, even though some medical authorities frown against it because it puts the woman at risk because of bleeding. So, like I still told a couple of people, I still spoke with a couple on Saturday. I said, my goal is to have you, madam, and your baby in good health. But if a fibroid is standing in my way of doing this, I may have to remove it to be able to get you back. I'm not going there absolutely because I want to go and become a superhero. I want to deliver the baby and remove all the fibroids and then oh no, I won't do this. The goal is you, a well mother, a well baby, and the happy surgical team thereafter. If the fibroid stands in my way, then I have to remove it to do what I want to do. But to say removal of fibroid during pregnancy, no. N-O, no.
So it doesn't like disturb the,
You just have to manage both. This particular lady,
Wow.
I managed her until she's term now. I managed her, and then we are planning for a delivery anytime soon. So you don't have to do anything until the pregnancy is term. And we've seen people with fibroids have their babies themselves. Like I said, the size, the location. I once operated a woman who was unregistered. She was unbooked with us, and she presented, I still remembered, in the midnight, 1:25 a.m. And while we were there to deliver, we realized that a particular huge fibroid was blocking where the baby was meant to pass through because she's been in labor for days. We had to remove the fibroid. In fact, it was on my way. It was in my line of incision. I had to remove the fibroid before I could deliver the baby. And after delivering the baby, I had to now think of how to reconstruct the womb in the midnight all by myself.
You may go through a lot. So I'm feeling a lot of goosebumps all over.
I had to reconstruct the womb. And I thank God in the morning I had to sit with her and make sure she was fine till morning. So that is it. So fibroids can be removed. Fibroid should only be removed if you are doing a surgery. You remove, but to say you're pregnant, go and remove the fibroid, come back and please don't try that. No doctor will even do that for you.
It's fair enough. I think maybe just a question that is running through
The mind.
This is a message from Kevin saying, since majority of fibroids don't cause any harm, what should be the next point of call when I discover it in my body? I think you've answered that.
Yes, I have. Yes. If you discover it, if it's not disturbing you, do nothing. Yes, it's not disturbing you, do nothing. I've seen people with fibroids, they conceived and they had their baby. I have a friend who had delivered two babies now. The fibroid is so huge that if you want to go after it, you remove the whole womb. So what did we do? And so for her, it's funny, it was even above. But the babies find a way of staying. So we had the first C-section, removed the baby, had the second C-section removed, and she was like, I am done. Up till now, the womb is still there intact. The fibroid is there, the womb is there, and she's not complaining of any period or anything. And I left her to herself. But for her,
But she's okay that way.
she's fine. The fibroid is really huge. So if she comes around and says she wants the whole womb out, I won't argue, because it's quite big. I will understand. But if it's not big, it's not huge, you're not bleeding excessively, it's not disturbing your period, it's not allowing you to, it's not disturbing you getting pregnant, let it be.
So that's the thing. I mean, if keeping it in itself, it's possible that you can keep it and you're not having all these problems.
Yes,
like
yes. I won't,
Wow,
you
this
won't
is-
advise everybody to go under the knife to remove fibroid because it's fibroid, as it were. No, it's when it's in.
No, I think the reason, because I think that, like I said earlier, there are a lot of myth around. So you hear fibroid
Yes.
and people are just
Yeah,
scared.
you know, it's a social discussion.
Yeah.
It's not like the medical classroom
Yes.
where you have to talk about symptoms and all that and the patient's state of health. We're just talking, it's social discussion. If you meet me and you by the roadside and you ask me, I'll tell you, is it disturbing you? Then leave it alone.
Because I've heard, when people say. Anyway, you've mentioned, I've had, an aunt who said, okay, fibroid was the reason she couldn't conceive over the years.
Yes. In such cases, of course, yes, it is becoming an issue. Then you should go after it. Because this person that I'm talking to you about was married for about 7 years, nothing, and then we did a fibroid surgery in March, and she turned up in June. Was it June or July?
Pregnant.
Yes.
Oh, wow.
And has been married for years. So if it's becoming an issue, get it out.
How? Let me understand. How is the fibroid doing that?
Okay, good. Somebody talked about submucous there. Yes, we have other fibroids that encroaches into the endometrium, that is where the baby would stay. So if, no matter what, when the fertilized egg comes, I cannot sit because the fibroid is there, it will not allow pregnancy to stay. So the person keeps going through recurrent losses, or pregnancy never even stayed at all. So it could be possible that the fibroid was blocking the position, the movement of things, not allowing the pregnancy to stay. It might not actually be in the endometrium, but just below the endometrium. And so when you removed it, it created enough space for the fertilized egg to be implanted, and pregnancy occurred at once.
Wow. Well, Mommy Docker says, I salute and hail you. You people are. It's God, there's a miracle worker.
Fibroid palava. This is so scary.
Oh, Lord have mercy. I mean, even as a man, I'm just really worried as it is, because growing up, it was when I decided to treat this that I, got open to some, facts about it. Because I've had the notion that I've in my head, I've treated fibroid the way I would treat cancer, but just hearing you speak about it and saying it's not so harmful as it is, that you can even live with it without it, doing anything to you, even with it being big, but I think at the end of the day is, don't just make your conclusions yourself, especially when you're having this examination is very important.
Yes.
If there's a need, how often should women check for things like this?
Thank you very much. Of course, like I say, it could come in. Now, fibroid is always diagnosed, in fact, between the age of 20 and 35. So, I would just say, regularly check yourself. Unlike the breast that you can do a self-breast examination, you can't examine your uterus yourself. So you need to say that. So if there is family history and you know that you have a sibling or your mom or a mom's sister or someone had it, then that means you may need to be checking the hospital. Even if it's once a year, you go for a check and do a scan. Right? Even before marriage and pregnancy and all that comes in, do a scan just to be sure. It's not bad. That's when you have a family history. And if you don't have a family history, well, anytime you go to the hospital and you feel like you want to have a check, people come to a check. It's good. Just do the check and know that you're fine. That's a feel good. I've talked about the feel good effect of being told there's nothing wrong with you, your organs are fine, your womb is fine, there's no fibroid, there's nothing in your kidney, everything is fine. It's a feel good feeling. So it's good to do it. regularly.
Oh, fair enough. Thank you so much, Doc, for such an insightful conversation this morning on fibroid. I'm already preparing myself for my family as it is, because all these bullet points that should guide you even as a man. This conversation is not just centered for women alone. We had a question from a man, Mr. Yusuf, asking about removing fibroid during pregnancy.
Yes.
I'm sure maybe the wife or someone he knows must have complained about it for that question to come out. So that's the purpose of this, to bring enlightenment to about some of these subjects. So thank you so much, Doc, for being a part of the conversation this morning.
You're welcome. Time really flies, though. You know that time is gone.
I'm telling you. All right, till next week, Monday, of course, we'll be back with yet another subject on health. Of course, you know what I would always say, a healthy life is your ticket to a wealthy life. So always make your health a priority. Have yourself a wonderful Monday. My name is Victor Richard, and I've been in conversation with Dr. Chukwuma Okoli.
Junior, get inside. You don't want to let mosquitoes bite you, do you? Me, I cannot treat malaria again, no.
Mama Junior, children will play. It is you that should keep your environment clean in order not to breed mosquitoes.
Even after netting the whole house and sleeping inside the insecticide-treated net?
Of course. Don't you know the state of your environment is as important as inside your house? Yes. When you get rid of stagnant water, at every space mosquitoes can breed, be rest assured, Junior can play all he wants.
My friend, the honorary doctor, I will do just that, so that my family can say bye-bye to mosquitoes.
Not just mosquitoes, but malaria.
Together, we can